Welcome back to TV5 News at 9. Today we are talking about sciatica with board-certified neurosurgeon Dr. Jagannathan. Thank you so much for being here today, Dr. J. We appreciate it.
Morning, Colette. Thanks for having me.
You're welcome. Okay, so we hear a lot about sciatica. Now, can you tell us, what is this?
Sciatica, for some people, is sort of a generic term that they use anytime they have back pain. But really what the sciatic nerve is, that it's a large nerve that travels down the back into the leg and the foot. That's formed by the bottom three nerve roots involving the lumbar spine. So anything that can irritate that nerve or the individual nerve roots can cause sciatic pain. And classically, that kind of pain is pain that starts in the back, radiates down the back of the hip, down the thigh, and oftentimes to the bottom of the foot. Sometimes patients can have atypical presentations of sciatica where it kind of stays more in one region than another. But the classic pain is kind of that shooting pain that shoots down the leg.
Now, Dr. J, are there certain causes of this nerve irritation?
Yeah, so the most common causes are degenerative conditions involving the spine. Those are conditions like osteoarthritis, where either a part of the nerve or the entire nerve is pinched on its way as it exits the spine. Other conditions can be things like disc herniations, which can push on a nerve that exits at a particular level, or can push on a nerve that's traversing the spine, moving down the spine from a particular area. In rare cases, the nerve may be entrapped outside the spinal canal as well, and that can also cause similar types of symptoms, although that's less common.
So for people who are suffering from this now, how is this diagnosed and then treated, doctor?
So the diagnosis is typically done through an MRI, which really gives you the best definition, the best visualization of the nerve and anything that's pushing on it. So a lot of times an MRI will pinpoint the area of nerve compression. Most common area that you usually see is L5 and S1 level, because it's a junction between the lower back, the lumbar spine, and the sacrum. In some cases, other imaging studies, such as imaging of the hips or the other joints, might be useful if there's suspicion that maybe there are other areas that may be contributing to the pain. Other studies, such as nerve conduction studies or EMGs, which are diagnostic studies that show how the nerve is functioning, are oftentimes useful as well. The treatment usually starts with non-surgical treatments. That's going to be things like rest, physical therapy, steroid injections, and when these fail, surgery sometimes can be used as a technique to help with the pain as well.
Now, when you talk about surgery, a lot of people like to hear about this. Tell us about the minimally invasive surgery.
So minimally invasive techniques involve using imaging technology that we use combined with the MRI to target areas where the nerve is pinched. So the idea is that you use X-ray guidance or fluoroscopic guidance to target the area of the abnormality specifically, so you minimize the size of the incision, and you also, more importantly, minimize the amount of disruption you do to surrounding tissues. Typically, this is done through a small incision, as I mentioned, so that you can identify the area where the pathology is, whether it's a disc or a bone spur or something else. And this can be removed and the nerve can be freed up. And the advantages of minimally invasive surgery or minimally invasive techniques are that it can often result in shorter hospital stays, less postoperative pain, and hopefully a quicker recovery for many patients.
Now, you gave viewers a lot of information, great information about this. Now, where can someone go to learn more?
They're welcome to visit our website, www.mi-neurosurgery.com, or contact our office, which is 989-701-2538.
Thank you, doctor, for calling in today. We appreciate it.
Thank you. Thanks for having me.
You're welcome. And if you want any more information, you can visit the hot link section of WNEM.com.